and has worked for IHA for the past 19 years, providing consultation to hospitals on employee relations, workforce, and unemployment issues. Deanna earned her Bachelor of Science degree in Political Science with an emphasis in state and local government from Boise State University. Broncos! She has also completed the Management Development Program in Human Resources from the BSU College of Business and Economics. She administers the operations of the Group Unemployment Compensation Program and provides representations to hospitals in administrative hearings before the Idaho Department of Labor. Other key areas of responsibility include workforce shortage issues, salary compensation surveys, as well as IHA Human Resources Administration. Additionally, she serves as the IHA representative to the Idaho Healthcare Human Resources Association and the Governor's Workforce Development Council. Please welcome everybody, Deanna McCutcheon.
This is so you guys can hear me. You may not want to know. So IHA, a lot of folks when I travel around think that the Idaho Hospital Association is a subset of government in the state of Idaho, and we're not. We are an advocacy group solely funded by hospitals in the state of Idaho. So we work on political issues federally and in the state that are hospitals, that are important to our hospitals. So we have a board, a governing board, and it is represented by every CEO within different regions of the state of Idaho. So we have CEOs from the east regions.
Okay, don't worry, I won't start over. So we have, as I said, CEOs on our board that represent all our hospitals around the state. We have CEOs from the eastern region, CEOs from the north, and CEOs from the southwest. And when we have board meetings, we get together and they discuss the issues that are important to their individual region and statewide, and then again federally. So we advocate at the federal level and the state level. And within IHA, we have different programs. We have the Cancer Data Registry, we have the Trauma Registry, and then we have staff that work directly with our hospitals. I work directly with all our hospitals on a day-to-day basis, dealing with employment issues. And I also administer the Group Unemployment Insurance Program. We have hearings that I attend for our hospitals, and I do have witnesses. So if some of you have been some of my witnesses in hearings, I probably won't remember, just to let you know. And all that is extremely confidential. So let's get into our workplace confidentiality presentation, and hopefully I'll be able to advance this guy. Maybe not.
I think it's this button on this side.
This one?
Yeah.
Alrighty, so today we're going to talk about a pretty serious issue. We all know health insurance portability and accountability. So I want to go over just the privacy rules for us so that we can re-familiarize ourselves with just the basics of these rules. So Privacy Rule 45 CFR, it requires covered entities to protect private patient information. And what they mean by this is it includes medical records, other data that contain individually identifiable health information that may be used or disclosed in any form, such as electronically or on paper or orally. So it gives patients certain rights, as we all know, and I know you've been through HIPAA training, and I know you've signed your confidentiality agreement in the past, so hopefully this isn't too much of a burden to go through this again, but it is very, very important. I deal on the back end with employees who've been dismissed for violation of HIPAA, and I can tell you in the issues that I deal with, it's one of the #1 serious consequences for employees when they do violate privacy. So patients, under the rule, must be given a clear written explanation of how healthcare information is to be used or disclosed with such use, and generally occurring only upon the patient's written consent. However, it is not required if it is in the course of their direct treatment, payment, and additionally other hospital opportunities. We don't necessarily need a patient's written consent in those circumstances. Patients will generally have a right to access their own medical information and may request an amendment to records if they so desire. A complaint procedure must be provided by the facility as well. Okay, so disclosure. Limit to the amount necessary for specified purposes. And non-medical disclosures are permitted only upon a patient's written authorization. Disclosures for public health or law enforcement purposes are permitted when required by law, without a disclosure being signed. And once again, we do not need an authorization for treatment purposes or payment or within our healthcare environment situation. But once we go outside in a third-party situation, we definitely do need that written disclosure. One thing that I want to talk about also are the Security Rule 45164. It sounds very dry, but it requires covered entities to implement policies and procedures to prevent, detect, contain, and correct security problems. One of these is the HITECH Act, which greatly enhances a patient's privacy. It provides individuals new rights to their health care information and strengthens the government's ability to enforce the law. So patients can ask for an electronic medical record under this law. If the patient pays by cash, they can also request that their provider not share the information or their treatment with their health care plan. So we, in the hospital, we do have a confidentiality agreement. I know you guys all have signed one in the past. And that confidentiality agreement is really important to your protection and the hospital's protection as well. I just want to read some elements of that confidentiality agreement that are very important in protecting us and protecting the patients as well. So ownership. The ownership of the information actually resides with the hospital. Even if you as the employee create the original document, the ownership of that information remains with the hospital. We, as employees of the hospital, are responsible for compliance, and we're responsible for knowing the practice policies of our hospital regarding confidentiality and regarding patient privacy. So within this confidentiality agreement, another very important element under HIPAA is reporting and proper disclosure. So we as employees are responsible for reporting and proper disclosure of information. And we report that obviously to the privacy officer, and we report it immediately. So when we also report, we have to go through a second step as well. What can I do to mitigate what happened? So we also agree that we'll take immediate responsibility to mitigate the problem, whatever it has been. Another important element of this agreement is the serviceability or survivability, and this agreement actually extends past your employment with Bear Lake Memorial. We as employees agree that even if we're not employed at the hospital, we will not disclose protected patient information. Alrighty, and the next area, civil penalties. I wanted to give you some information about what this consists of. So if an individual did not know or should not have known a violation, the fine is $100 or $50,000 per violation, up to $1.5 million for all identifiable violations per year. It's a penalty, no penalty at all if corrected within 30 days. So if there's an issue, don't delay in reporting it. Report it and let's get it corrected. They may waive or reduce the penalty. The OCR, Office of Civil Rights, may waive that or reduce it, the penalty, if they believe it's excessive. So let's talk about a violation due to reasonable cause. The fine for that is $1,000 to $50,000 per violation, up to $1.5 million for all identifiable violations per year. and no penalty if corrected in 30 days. Willful neglect, these get more serious, but correct the problem within 30 days, $100,000 to $50,000 per violation, up to $1.5 million for all identifiable violations per year, and effective 1/18/11, again, the OCR must impose a penalty here. So the last one, willful neglect but did not correct problem within 30 days, at least $50,000 per violation, up to $1.5 million for all violations per year. And again, they must impose a penalty. OFC must impose a penalty here. So this is very, very serious. Later on, I'm going to go into some examples of the most common types of violations. Let's talk about the criminal penalties here. So the criminal penalties apply to the employees or other individuals who obtain or disclose PHI without authorization. So knowingly obtaining PHI in violation of the law is a $50,000 fine and 1 year in prison. Committed under false pretenses, a $100,000 fine and 5 years in prison. And then intent to sell, transfer, or use for commercial gain, a $250,000 fine and 10 years in prison. I was on the HHS site about a week and a half ago, and I noticed a lot of these violations can occur very innocently. A situation where, one example would be a situation where an individual was given instructions to give a message to a patient via the phone. But in the instructions per the patient, it said, leave the information on my work phone. Well, the hospital employee left the information on the individual's home phone. So the patient didn't get the information, but an individual that the patient didn't want to know received the information. So it's that quickly that something can go awry. In this particular situation, to remedy the problem, they came up with procedures and what kind of protected health information can be left in a message and what cannot. So they decided they would leave minimal information, and that's a part of the policies that everyone is aware of now. So in the state of Idaho, the Attorney General may sue in federal court if Idaho residents have been or may have been adversely affected by a HIPAA violation. They can issue an injunction. Damages are $100 per violation, up to $25,000 per type of violation per calendar year. So they can also impose costs and attorney fees. And again, they must notify HHS, and HHS must intervene. I want to give you examples because I think these are really important. To me, this is real working stuff that we need to know. They're basically the most common HIPAA violations that actually occur in our work environment. So number one is employees disclosing information in casual conversations about patients to friends and coworkers. This is a tough one. It can't happen, but it does happen. Number two are medical records mishandling. So accidentally leaving a chart, for example, in a patient room, rooming another patient, and that information out there and available. If we don't have electronic, health records, or actually leaving a record up on a screen. The number three is lost or stolen devices. And this is a big one nowadays. Theft of PHI through lost or stolen laptops, desktops, smartphones, and other devices if patient information is attached. If we're going to use these type of devices, they have to be password protected and they have to be encrypted. Number four, and this is an interesting one, it's texting patient information. So a lot of times what we need vital signs as soon as possible, we need test results for our providers, and it's a very easy way to get that going is to relay it quickly through a text message. But what this does is it leaves that message vulnerable to cyber criminals and hackers. So in order to be able to do that, both devices absolutely have to be encrypted or it cannot happen. This other one is social media, and what happens here, posting of photos on social media of patients. So, you know, it's very, very interesting that this actually would occur, but it's one of the top 10 violations of HIPAA. Wanted to let you know too, recently I was in a hearing on an individual who was dismissed for misconduct at one of our hospitals. And this individual didn't really have any direct knowledge. He was a security guard, but what he did was the information as part of an investigation, he just chose to casually chat about that, you know, during lunch with other employees. And once again, we can't do that. We leave our patients vulnerable and ourselves vulnerable when that happens. So that individual was dismissed for misconduct. Another situation, an individual was in a social environment at a restaurant and disclosed the girlfriend's protected health information in that particular environment to friends. Again, people lose their jobs because of this type of behavior, and it is very, very sad. The next one, number 6, are employees illegally accessing patient files without a need to know and without authorization. And this happens obviously when people maybe see someone they know, or there's been a famous person at the facility and their curiosity gets the best of them and they access the patient record. It absolutely cannot happen. Number 7 is social breaches. And these are tough for us in rural situations because what happens is we're in a social environment, maybe at a dinner, that type of thing, or a party, and a friend of the patient comes up to us and says, hey, how's he or she doing? And the information gets exchanged. So once again, that absolutely can't happen in a social environment, and especially in a rural area where everybody knows everybody, we kind of tend to feel very comfortable, but that's a red flag. So what we want to do is we want to think ahead of time, hey, I'm going to be here. If I'm questioned, what's my response going to be? Okay? So just so that you're aware, and I'm sure that you realize the seriousness of that. Okay, authorizations. So written consent is required for use or disclosure of individuals' protected health information that is not used for treatment, payment, or healthcare operations. So if you're not sure about this, make sure that an authorization is achieved. Okay. Do you have any questions about this portion so far? I know you've probably heard it before. All right. So when we have problems, and our licensing boards have problems too, so this information is generally reported to them. So it'll affect a license under the Board of Medicine, Board of Nursing, Bureau of Occupational Facilities, Bureau of Facility Standards, CMS, and other accreditation bodies. So just to let you know, it is extremely serious for them when they have to act on the licensure. All right, so employee discipline. Covered entity must develop a policy for sanctioning employees who violate privacy rules. They must sanction employees who violate those rules. That's all in the law. We have no choice, and we wouldn't want it any other way with our protected information if it is revealed. And then they must document those sanctions as well. So an example of inappropriate disclosure would be snooping in patient records, lunch table or water cooler discussions, or non-physician sharing test results with patients. We need to be very, very cognizant of this type of situation. I had another situation that was very interesting, And again, it was a HIPAA violation where an individual was dismissed, but she was actually, the patient was done with her consultation with the doc. The patient was out in the reception area, and this was an MA that was out discussing the patient issues with the patient in the reception area. Well, after that happened, a couple patients came and reported it. They were sitting there, and it was investigated, and of course the individual had to be let go because it was a direct violation of the patient's privacy. So this can happen at any time, we all know that. Just need to be very, very aware of the rule and what is going on there. There's another area that I wanted to focus on, and it kind of focuses us a little bit away from HIPAA and to our own employment environment and our interactions on a day-to-day basis. So it's ownership of information. So think of ownership of information just as you would a tangible object. Oh, sorry, my slides are out of order. All right. So we're going to start with what is involved in thinking employee privacy, okay? And this is us. This protects us in the hospital. So stop and think about the amount of information and the records that we maintain about employees. And think about the valuable information we possess about patients. But ask yourself this question: do I treat these two groups of data the same when it comes to confidentiality? According to the Employment Law Division of HR Specialists, their employment law attorneys warn that some employers are not treating these two groups the same. So as a result, employers are taking a substantial risk by not focusing time and effort into protecting employee privacy. All right, so what we want to do is think privacy in our minds. So we as employers cannot seemingly shrug off employee privacy. Lax attitudes in protecting employee confidentiality can quickly become a legal issue in many workplace decisions and activities. So certain employment-related data must be protected. We will focus on frequently overlooked employment data categories that can and do cause problems. The protected information applies to all employees, supervisors, managers, any of us that come across this information in our daily work environment, directors and board members, and it relates to the business environment. So normal documents, normal documents in the selection process, such as applications, references, and notes of interviews, must be kept confidential in the personnel file. Other confidential information exists beyond the personnel file. So some of us have 360 evaluations where everybody has input on your evaluation, your peers and that kind of thing. And then performance reviews as well, and peer interviewing. So during these processes, managers and coworkers may stumble upon confidential information without knowing it. So we can stop privacy leaks before they start by everyone focusing on keeping all the information confidential and do not share the interviews and the job reviews out there with just anyone. Very private information. So HR in these situations, or the hiring manager, should really be the only ones who check references. Results should not be shared with others, especially subordinates, if they assist in the interview process, and sometimes that they do, because we want, a lot of times we will have them interview as a panel, a new employee. We want a good fit, and we want input on if that individual would be a good fit. So subordinates who are part of a search committee should be excused from the process when hiring recommendations are discussed. And never allow outgoing employees who oversee the selection process for their replacements. Because once the outgoing employee is gone, they may choose to share protected information that they've been exposed to in the process, and that is not a good situation. it is a violation of an employee's, a potential employee's confidentiality if that information is shared. So what I want to do is look at a couple scenarios. So an employee shares private a private health issue with a coworker, only to find that the private health information has been spread to others within the business. The employee in drug rehab, which is number 2, returns from a leave of absence to find the details of her recovery announced at the office. So these scenarios carry potential legal hazards. The employer opens itself up to lawsuits under the Americans with Disabilities Act, confidentiality provision, when private medical information is disclosed. An employee does not need to be disabled to file a lawsuit under the ADA. Additionally, former employees can file as well. And in the ADA, just to let you know, if an employee is not disabled and the employer has created a perception of disability, the employee now falls under the protection of the American Disabilities Act. Had a situation a few years ago where an individual had brain surgery and they had a full release to return to work. Fine, they returned to work. I was actually in a consultation for a hearing, and I heard the manager say, yes, she returned to work, but is not right. Things are not the same. Well, we had to stop right there and discuss that you as the employer, your perception is not what we need to rely on. In those situations, we rely on our medical release, and your perception cannot be valid. It should not be talked about to anyone. If you have a perception like that, keep it in your mind only, and try not to have one in the future. Because once again, we as the employer, if we create an environment or a perception where somebody has a disability, they in fact do fall under the Americans with Disabilities Act. And additionally, with HIPAA, liability is faced under HIPAA as well, as we're all aware of that. Keeping health data private and secure is a top priority. And that's the slide for that one. Alrighty, so how to protect confidential information. The best way to protect confidential information is to provide employees with a framework through procedures and policies. And an effective confidentiality policy defines confidential information and non-disclosure rules. And you have a policy like that, and it is a great policy. So oftentimes, employers incorporate their own confidentiality into the employee handbook. And in addition to the handbook, having the employee sign a confidentiality policy or agreement is stronger, and that contract is legally binding as well. And additionally, you guys do have one of those legally binding confidentiality policies, which is wonderful, because it explains to you the specifics that we need to deal with on a day-to-day working environment. So this slide shows us our non-hospital disclosure policy. It's in your handbook, actually, on page 26, if you want to take that home and read tonight if you're having trouble falling asleep or something. All right, so non-disclosure. I'll read it for you now, so you'll know. Employees exposed to confidential information will not disclose such information outside the requirements of their job. The following are some examples of confidential information: compensation data, patient lists, financial information, labor relations strategies, marketing strategies, new materials research, pending projects and proposals, and patient information. So this is your hospital business that cannot be disclosed. We have our non-disclosure policy that deals with it. All right, and then again on page 19, some key elements here for us. Safeguarding the confidential nature of information concerning the hospital and its employees and patients is mandatory. You may have access to confidential information because of your work, and it should be used for no other purpose. So a breach of confidentiality might not only be cause for disciplinary action, but it may be disciplinary action up to and including termination, but could also result in serious legal consequences for the hospital and for the employee themselves. In a lot of fines, it's not just the hospital, it's the employee as well, especially under HIPAA. In the process of performing one's work, it is possible to overhear information regarding hospital business, such as terminations, conditions of patients. There are a myriad of examples, and we could go on forever. So this information should not be discussed with coworkers or individuals outside the hospital. Be particularly careful about your conversations in elevators, hallways, eating places, computer conversations such as email and Facebook, and other places of public assembly within the hospital. All right, you'll be relieved to know that this is my last slide. But this information I think is interesting, and it's something we can take away with us. So think of ownership of information just as you would a tangible object that has an owner. So if an employee communicates confidential information to a supervisor or fellow employee, or if that fellow employee is a friend, the employee still owns that information. This is also true if you hear the information in a third-party environment. That employee still owns that information. Nobody else does. So a supervisor or other employee that has been held in confidence does not have the right to pass that information along unless, and this is a big unless, the owner gives permission or some overriding concern arises. And that overriding concern may be, I've had a couple situations where concern about a health situation, and then I would go to the security and privacy officer and discuss it with them and see how your facility would handle that type of thing. So do you guys have any questions? All right, we are done. Thank you.